Are you wondering what you can do to get your constipation taken care of naturally? In today's video, I'm gonna go through 7 drinks that I recommend that will get you going naturally, and we'll also discuss 5 drinks I'm gonna recommend you always avoid when it comes to constipation. If things are getting stuck, you wanna be flowing and going, this video is for you guys. Let's talk about food. Howdy y'all, I'm Dr. Islam. Yo! I'm a board certified gastroenterologist trained at the Mayo Clinic. I've treated thousands of patients who've had issues when it comes to constipation. We would love to be a partner on your journey. It's very easy. Visit us at gastro.com, make an appointment. We can see you today or tomorrow. You don't need a referral. We can find out what's going on with your constipation and get down to the root cause to get you feeling better. So why are you constipated? Very common question I get from a lot of patients. What I tell patients is that it's basically 2 problems. That's it. That's what constipation comes down to. Number 1, it's either a colon problem, or number 2, it's either a butthole problem. Yes, I said that, you heard me. Let me explain. So for most patients, if it's a colon problem, it's the way the colon contracts, it's the amount of water going in, it's the type of foods that are going into the colon. And because of that, things are not moving appropriately. This is the condition called IBS with constipation, which most people have. And that's kind of the focus of what's going to go on with this video. That's why drinks can help out. But for other individuals, it may be a butthole problem. Yes, you heard me. The rectum muscles may be so tight that nothing is going to go through. And that is called pelvic floor dysfunction. I have a lot of videos on that. And if you're wondering if you're suffering from this, I recommend for you to go to those videos. But basically, these are the 2 problems that we have. Now, when it comes to a colon problem, which is what most people have, it can be so many different reasons why you are constipated. So by the time you come see me, you've already done all these things, I'm sure. But it's lack of exercise, lack of water, lack of movement, lack of a rhythm. Basically, it's a lack of everything. Your body thrives on these things, and it needs these things to get you going and flowing. And so you have to make sure we optimize some of these options when it comes to a colon problem. So if you're not walking or moving every day, do that. If you don't have a diet that's high in fiber, do that. If you're not drinking enough water, make sure you do that. If you don't have a rhythm when it comes to bowel movement, make sure you're doing that. These are kind of the foundations of when it comes to constipation. And sometimes that doesn't work, and that's okay, because that may be the reason why we may need a boost to get you going and flowing to hopefully help out when it comes to issues with constipation. Other things you want to kind of keep in mind, certainly it could be secondary cause constipation, medications like opiates, calcium channel blockers, or blood pressure medications, beta blockers. These things also can affect constipation. But a big one people always forget is what you drink. Yes, it's not sometimes enough just to drink water. Sometimes what you drink can make your constipation worse, but other times what you drink can make your constipation better. So if you want to get your constipation better and you tried everything else, here's what I'm gonna recommend. Here are 5 drinks I want to make sure you don't incorporate when it comes to constipation. Number 1, alcohol. You're like, bro, come on, man, I want to drink, I want to enjoy myself. All right, that's fine. You don't have to eliminate it. We do know that alcohol will dehydrate you. So if you're drinking water and drinking alcohol, you're basically negating the effect. Alcohol is a direct toxin to your body. It 100% straight up is. It destroys everything. Your esophagus, your stomach, your pancreas, your liver, your gut, your microbiome, and your constipation. So if you're drinking alcohol, minimize the alcohol. You'll start to feel better, but also your body will thank you, because what happens whenever you drink alcohol, especially when it comes to constipation, is that not only does it dehydrate you, it changes the gut microbiome. And we have found that the gut microbiome often plays a role when it comes to constipation. So those individuals that have constipation, they're more likely to have a change in the bad sense of their gut microbiome, more bad guys, more bad bacteria, more bad issues going on. And those individuals that stop drinking alcohol, literally within a few days, alter their gut microbiome to the better, and that better gut microbiome will make it easier for you to go. So if you can minimize alcohol, even better, maybe eliminate it, you will start to feel better. Number 2, sugary sodas. They suck. They're full of sugar, they have no fiber, they're not good for you. So this includes regular Coke, regular Pepsi, regular Sprite. Now, dietary drinks, if you enjoy that, that's okay. I'm not gonna be one of those doctors that's gonna tell you, hey, eliminate all dietary drinks, unless you have bloating, which that may be the reason why. But if you don't have bloating, just eliminate sugary drinks. It's not good for you, man. I mean, it's not good for you. You're just basically just drinking a whole glass of sugar and just pouring it down your mouth. Oh, sounds terrible. Number 3, energy drinks. All right, Don't do this. They're high in caffeine. Combined with artificial sweeteners, it's a bad combination. Now, if you want better energy, and I'll talk about it in my drinks to use, I'll give you another hint. I'm gonna recommend another drink. But these high energy drinks, these high caffeine drinks, they're not good for your gut. They're not good for your constipation. They're not good for your body overall. And they're not good for your sleep. If you're having to drink this many energy drinks, let me just tell you, there's probably something wrong with the way you are sleeping, with your stress, the way you're adapting. Because it's not normal to drink a 5-hour energy like every hour. That's not how it works. That's not normal. So if that's the case, you really need to step back and understand, why am I doing this? What is going on? It's not good when it comes to constipation. Number 4, excess dairy. So when it comes to dairy, we commonly think that dairy will cause diarrhea, and it does. However, in a lot of patients, dairy can actually cause constipation as well. And so if you're one of those, you drink a lot of dairy drinks, have a lot of dairy in your drinks, or eating ice cream. I don't know why. Well, actually, ice cream is pretty good, so I do know why. But have a lot of creamers, cheese, and you notice you're constipated, try to minimize that and see how you feel. You may be one of those percentages that's low in which dairy can make you more constipated. Number 5, protein shakes with no fiber. Now listen, I'm trying to get swole, I'm trying to get cut. Summer's coming on here, but protein drinks, especially those that don't have fiber, can really slow down your digestion. An easy fix, add in chia seeds to your protein shake. It'll make you go, it'll get you flowing. You can go and get swole and, get cut and, look good, just like me. All right, I'm just joking here. I don't really like that. Just trying to have a little fun here. All right, now that I talked about the 5 drinks I want you to avoid, here are 7 drinks you can start doing today to get you going and flowing, get that train moving, get that, those bowels pumping, and to get you feeling better. Number 1, warm water with lemon. Now, you may have seen this on social media. It's all over social media. Let me tell you, it actually works. It's fantastic. So warm water or something warm in the morning is one of the recommended treatments that I recommend to all my patients when it comes to constipation. Having warm water will stimulate what's called the gastrocolic reflex. It'll get you going and flowing. And it has to be warm. It's crazy, but there's evidence to suggest that warm water will help out. And lemon is an added benefit because it has citric acid. Citric acid can help promote your digestive enzymes, which will also allow you to have better bowel movements and to enhance the gastrocolic reflex, the reflex that occurs or starts in the stomach and goes through your small intestine and goes to your colon. So try to have that warm lemon water first thing in the morning as soon as you get up. Number 2, prune juice, the OG drink. That's the gangster drink that's been around for a long time. Your grandparents are using it, people in nursing homes are using it, and you should use it as well. Now, prune juice actually has a very special ingredient called sorbitol. Sorbitol is a sugar water that gets broken down in your colon to actually absorb more water and to push things through. And this is why we love prune juice and prunes in the GI world. Now, in addition, it also has fiber, which is the background for gut health. And so use the OG. It's simple. No one's gonna make fun of you. It's all good. And even your GI doctor itself, I recommend prune juice. I use it all the time. Number 3, you remember how I talked about in the morning, or don't use those caffeine drinks? Here's what I want you to do instead. Coffee, but it's gotta be black coffee, guys. All right. We can't use this whole frappuccino, sugary coffee, add in whipped cream and all that jazz. The evidence is suggestive of straight up black coffee. And there's so many benefits when it comes to black coffee. So number 1, it'll get you going. It'll stimulate your GI tract. Number 2, the caffeine itself will give you energy that you need, but also the energy you need for your gut. Number 3, it can help out in so many other organs besides your gut. There's evidence it can help out when it comes to liver damage. In fact, black coffee can reverse liver disease and liver damage, which is amazing. It also stimulates what's called the gastrocolic reflex, very similar to what warm lemon water does. Now, I have to stress once again, it's not the coffee that's full of all the yumminess. The evidence is black coffee, 2 to 4 cups per day. It can be decaffeinated or caffeinated, but do this in the morning to start things going, to get you flowing, and to get the train moving. Number 4, aloe vera juice. Now, this one's becoming popular, and there's good reason why. Aloe vera juice can actually soothe the gut lining to make it easier for you to have a bowel movement. Here's how it works. Aloe contains anthraquinones, which are a natural laxative. And so it actually allows you to naturally move things along gently and easily when it comes to your gut issues. It also has anti-inflammatory properties to help out when it comes to bloating and gut irritation as well. So if you feel like you're just inflamed, or if you want a natural, gentle laxative to get you going, aloe vera juice may be the route to go down. Now, start off small, maybe 1/4 a cup, and then you can titrate it based on that. but it's a very effective natural laxative. Now, it doesn't work for everyone, especially if you're so stopped up that you can't get anything through, but as a gentle laxative, it may be a good starting point to get you going and flowing. Number 5, herbal teas. So teas like peppermint, ginger, chamomile. These are effective options when it comes to getting your constipation taken care of. A lot of people are tea drinkers. I personally am not, but if you are a tea drinker and you're having issues with constipation, pick your favorite tea in the herbal teas and sip this all throughout the day. And I would just continually sipping this, because not only are you getting the water from this, you're getting the benefit of the tea itself to get you better bowel movements, to hopefully get you feeling better. Now, some people have thought about senna tea. Let me tell you about senna tea. So senna tea can be helpful, but it's a little bit more powerful. It actually acts also as a natural laxative. So the other teas, for example, peppermint and ginger tea, you can use every single day, but senna tea, I typically recommend this on the occasional basis, mainly as a rescue tea to get you over that hump, to help out when it comes to constipation. Number 6, pear juice, the OG cousin to prune juice. Now, if prune juice is too much for you, you don't like the taste of it, too much sugar, pear juice is a effective alternative that you can use instead. It also contains a high level of sorbitol, just like prune juice, but has a milder flavor and more of a water content. So you don't get, that taste that sometimes people don't like when it comes to having a prune juice. And this is great for kids, great for anyone, and also great, especially for those individuals that don't like prune juice, because it has the same effect on your gut. Number 7, plain water. Yes, you heard me, water itself. Listen, man, I have to tell you the obvious sometimes, because sometimes people don't realize the obvious. If you're not drinking enough water, you're gonna be constipated, okay? So make sure you're at least drinking enough water. Here's what I recommend. 2 cups in the morning, 1 cup before each meal, and 2 cups before you get. Traditionally, they'll get you enough water. Now, if you're an athlete or you work out, you may want to consider more, but adding plain water, that will get you going, they'll get you flowing. Don't forget the basics, because that will make a difference as well. All right, so let's recap it all and bring it down together so we quite understand what's going on. So the 5 drinks I want you to avoid are, come on, say it after me, alcohol, sugary sodas, energy drinks, excessive dairy, and protein shakes with no fiber. And the 7 drinks I want you to start are warm water with lemon, first thing in the morning, prune juice, the OG, coffee, just black coffee alone, none of the fun stuff in it, aloe vera juice, herbal teas, pear juice, the cousin to the OG, and then last but definitely not least, plain water. All right, guys, that's it. Your tips from a Mayo Clinic GI doctor on the drinks I recommend to get you going and flowing, and which ones to avoid as well. This will hopefully help you and get you feeling better. And if you got your own gut-friendly drink you want to recommend, drop a comment down below. I would love to get your recommendations for me and my audience. I'm always about learning, and I love to learn from my audience as well. Don't forget to like, share, and subscribe. Hit that bell to get more notifications about these videos, and come see us. Visit us at allbutgastro.com, where you make an appointment. We can see you today and get you feeling better and get you back on track. Thank you for watching. Look forward to seeing you guys on future videos.